Just this morning, Nancy and I were on a Zoom meeting today for prepping for a podcast, The Caregiver's Journey. You should check it out with Sue Ryan and Nancy Treaster. This episode tackles the question of when should hospice be called in for the patient with Alzheimer's and other kinds of dementia. What became quickly clear to all of us is that there needs to be a better understanding of what hospice is. So often people believe hospice is for a person close to death. The reality is hospice is less about dying and more about living the best that we can until we die. Medicare regulation states a person has approximately 6 months or less before death. That's the regulation how to go on hospice. This means they do not have to be on death's door to come on to hospice. Medicare has guidelines to help determine if a dementia patient qualifies for hospice. I see a lot of hospice patients with dementia or Alzheimer's and spend a great deal of time each week in memory care units. Unfortunately, the common scenario is a dementia patient is declining. They have a fall and break a hip, which sends them to the hospital, and they come home on hospice. This is the worst case scenario for coming onto hospice for the dementia patient. By identifying decline and getting them onto hospice earlier rather than later, they can enjoy an increased quality of life, even while they're declining, and avoid the trauma of a fall or other episode and of a hospitalization. So how do we know when a person with dementia would benefit and qualify for hospice care, which will improve their well-being as they're facing the end of life? Well, there's usually weight loss, so monitor weight. This can happen even if they are still eating regularly. Are they more confused, unable to recognize people that they used to? Is it harder to string sentences or words together? And are there more periods of anxiety, agitation, and hallucinations that can lead to aggressive behaviors? Are they no longer able to feed themselves? And are they coughing or choking when eating and drinking? Is the ability to walk or get out of a chair independently going away or gone? If you're seeing some of these changes in a dementia patient, ask their primary care physician or their provider for a hospice evaluation that will look at the big picture and know if they qualify for hospice, and if not, that's okay. At least now there's a baseline that's documented and we can watch it and monitor it. We will let you know when the Caregiver's Journey podcast will air this episode, and it will be much more, and there'll be a lot more in it about when to call hospice for the dementia patient. You can also ask myself or Nancy any questions on our blog, The Hospice Care Plan, and you can get a copy of our booklet, The Hospice Care Plan, A Path to Comfort. And it helps guide families and caregivers how to hands-on care for symptom management for the hospice patient. You can also go to our YouTube site, The Hospice Care Plan, and see our symptom and care management videos that are free. You can just type in The Hospice Care Plan in YouTube.